Hello, Dr. Todorova. My name is Bryan Haas. I'm here with my son, Jaden. Jaden, do you give us permission to go ahead and film this cardiovascular and peripheral examination?
Yes.
Okay, awesome. Before we start, first, of course, I'd wash my hands. After that, before this exam, I want to take blood pressures, both supine, bilateral left and right, and then we'd have him sit up and take bilateral blood pressures sitting both left and right as well. So when we begin the exam, the first part of the exam is looking at his jugular venous pressure. We're going to have Jaden turn his head to the left here. We're on this right side. We're looking at his jugular venous pressure there. We can see there's the external jugular there. Just inside that, you can see the pulsation of the internal jugular vein. Jaden's is extremely low. His jugular venous pressure is very low on his neck there, and that's very common with athletes or someone who's well conditioned, who's in really good shape there. So if we want to measure that, we take a look at that. This is going to be really low there. Measure that. There's the jugular venous pressure just above the sternal notch there. We take a straight edge going horizontal out, take a ruler there above about the angle of Louis there, and when we measure that, his is very low there. It's around 1.5 centimeters. The JVP should be less than 3 centimeters, which is normal there. Okay, the next part of the exam is we're going to palpate his carotid arteries there. When we do that, we want to make sure, one, that we don't palpate both bilaterally, and two, we don't palpate too high in the carotid arteries there. There's the carotid sinus that can change blood pressure and or heart rate. So we take our two index and our middle finger there, just gently palpate. We should be able to feel that pretty easy on Jaden, and we do. We're feeling for the amplitude, and we're feeling for a strong pulse there, and we can feel that really well on Jaden. We're also feeling for it to see if there's any thrill on either side there as well. And the amplitude and the upstroke is very strong on Jaden, and there's no thrill on either side there. Next part of the exam is we're going to auscultate the carotid arteries. So we're going to auscultate the carotid arteries. First, we're going to auscultate with the diaphragm. So we're just going to gently place, I hit this backwards there. Gently place this here, and we can listen. The carotid arteries there on both sides bilaterally with the diaphragm. And then we want to listen. Could better hear the bruits on the carotid artery with the bell. Now we have the bell on both diaphragm. Both carotid arteries here. Everything's normal there. The next part of the exam is inspection. We're going to inspect Jaden's overall chest here, looking for any abnormalities, any asymmetry, etc. And then we're also looking for any precordial pulsations, apical impulse. Do we see any ventricular pulsations, etc.? We don't see any of that on Jaden in that area there. The next part of the exam is we want to do palpation. So we want to palpate the apical or the point of maximum intensity. The PMI, point of maximum intensity, which is mid-clavicular line, fifth intercostal space. With Jaden here, I can imagine, and it's true, it can feel his point of maximum intensity really well there. On someone that you can't feel that so well, you'd have the patient lay on their left side, roll over to the left side, and then you'd be able to feel that that point of maximum intensity would be able to be palpated a little bit easier. You can palpate Jaden's very easy there. Next part of the exam is we're going to palpate all the areas of the heart. We're going to start with the aortic area here, which is second intercostal space to the right sternal border there. That's the aortic there. That's on the right side there. And then on the left side of the sternal border, second intercostal space is the pulmonic. Palpating that. And then we come down to the third is the Erb's point. We're palpating for any thrills, lifts, or heaves as we We palpate that, and with the lift, you definitely feel your finger come up with that lift when you palpate that, a lift. Then we come down to the fourth intercostal space here, left sternal border, and that is the tricuspid. And then fifth intercostal space, mid-clavicular line, that of course is the mitral area there. After we palpate those, we want to palpate the abdominal aorta here. We want to locate the umbilicus and come in with 2 fingers. We have to kind of press in sort of firm to feel the abdominal aorta, and to help feel the abdominal aorta, we ask the patient to take a deep breath. We ask the patient to exhale. As the patient exhales, go ahead and hold that. We're going to press in with our pads of our fingers there, and there, now we can start to feel the abdominal aorta. With Jaden, it's pretty thin, it's about 1 inch or so. Somebody who's got abdominal aortic aneurysm, that abdominal aortic aneurysm is going to be really wide there. So with Jaden's is about 1 inch there. So we got that, we palpated the abdominal aorta. Next part of the exam is we're going to auscultate all the areas of the heart. We're going to auscultate with the diaphragm first of the aortic valve. And we got the pulmonic valve. The herbs, we're listening for any murmurs. And we got the tricuspid. And we have the mitral. We also do that with the bell, and we're listening for, like I said, murmurs, normal S1, S2 splitting, any extra sounds like S3 or S4. There's the aortic, there's the pulmonic, and we got down to the left sternal border, third intercostal space is herbs. Then we go down to the pulmonic with the bell. I'm sorry, the tricuspid, and then the mitral with the bell as well. We also want to listen for some normal, what's called physiological splitting. And that can be heard, well, first of all, what that is that the aortic and the pulmonic valve should close at the exact same time. And as the patient is inhaling, that the pressure, the inhalation of upon inspiration will cause sometimes a normal splitting of S1 and S2, and cause the aortic pulmonic valve to close separately, like split-second difference there. So we'd ask the patient just to breathe, try to breathe a little bit, some deep breaths actually. And we'll go in the aortic area and see if we could listen for the splitting. And again. And the pulmonic there. I can hear a slight splitting in the aortic, but not so much the pulmonic area there. The next part of the exam, after listening to that, we want to auscultate the abdominal aorta there, and just listen for the pulsations there with both the diaphragm and the bell. And the bell, we're listening for bruits, of course. The vibration in the blood vessel. That's good there. Good. Okay, that concludes the cardiovascular exam. Now let's do the peripheral exam. With the peripheral exam, we're looking at the extremities. We're looking at the overall color of the extremities, both upper and lower extremities. Jaden has nice pink color in his legs, in his arms, hands, feet. Whenever we're assessing and just feeling for temperature to make sure he's got no increased temperature in any of his extremities. We're looking to see if there's any edema, any swelling. Does he have any shunts in the arms, legs? Is there any varicose veins anywhere? Any pitting edema? Any abnormal swelling? We don't see any of that in Jaden's extremities there on bilateral, both sides there. We're looking to see, if we look at the hands there, we're looking at the fingers for any cyanosis, any clubbing, any, we're looking for the capillary refill as well. So we press in there, we should have a nice return of the capillary refill. On both sides there, we're looking to see if there's any splinter hemorrhages there. We don't see anything there. Capillary refill looks really good in the upper extremity. Same with the lower. We want to see and check the toes and see if we have a nice capillary refill, any splinter hemorrhaging of the toes, but most of the time we're going to find that in the upper extremity there. Cyanosis, we don't see any cyanosis there. Next part of the exam, we want to check all the pulses. So we're going to check the brachial pulse there. So we're going to check the brachial pulse. If we find the brachioradialis there with our two fingers just inside there, we can find the brachial pulse there. So with the pulsations, depending on the reference, I've seen references having normal as 2+ out of 3, and then other references say 3+ out of a scale of 1 to 4. I'm going to say Jaden's got a nice strong pulse, a 2+ out of 3. That's the brachial. Then we come down here and palpate the radial, which is on the radial side of the wrist here, just above the thumb. Pretty easy to find there. Same on both sides. We do bilateral brachial, bilateral radial. Good. Then we're going to palpate, and we're also going to palpate and auscultate, or we're actually going to auscultate the femoral. I can palpate his femoral pretty easy there. It's right on the inside of his groin there. And we're going to auscultate that as well. So we're going to auscultate the femoral with both the bell and the diaphragm. This is the bell, the diaphragm and the bell on both sides there. And there's the diaphragm, and we do the same with the bell. Good. Probably go a little bit lower there to find that a little bit better, the femoral artery there. Next is the popliteal artery. So we come underneath here. So with our pads of our fingers there, we come underneath Jaden's knee there. And we're going to palpate going medial. We're going to touch our fingers there and then start to pull or retract our fingers lateral. We're going to bend his knee up there and press into the popliteal fossa there. And then as you press into the fossa, you'll be able to feel the popliteal artery come into the palpation there. Again, we're noting the strength of the pulse there. We should be at least 2+. There's a popliteal artery, and we do that, of course, on both sides there. Everything's done bilaterally there. Feel that bilateral. And we're going to come down here and check the dorsalis pedis pulse here. That's right on the patient is dorsiflex their foot. Let's bring that up a little bit there. You can feel the dorsalis pedis right there. Both sides bilateral. We're noting. It's pretty easy to find on Jaden. And then on the inside here is the posterior, right behind the medial malleolus is the posterior tibial pulse right in through here. That's pretty easy to find on him as well bilaterally. Good. And those pulses are all nice and strong there. Okay, thank you so much, Dr. Todorova. That concludes the peripheral exam, artery exam, and the cardiovascular exam. Thank you so much.